Today we're going to talk about mental health. We're going to start by talking about phlegm in TCM, and phlegm specifically misting the mind and understanding how do we get phlegm, how do we get rid of phlegm, what is phlegm. Just want to make sure that we really understand that because that's a very TCM concept, right? So we're going to talk about the 13 ghost points because that's the whole lecture is about, right? And we're going to talk about points combination that are great to use in clinical practice because my goal is to not just teach theory things, but to make it applicable in practice, right? So that's the whole point of this lecture. Welcome back to my channel. If it's your first time here, I'm Clara. I create acupuncture and Chinese medicine content for practitioners and students, making it easy to grasp and fun to learn. Let's talk about phlegm and TCM. So first of all, let's define phlegm, and then we'll talk about how do we get phlegm and how do we get rid of phlegm, right? So basically, we have two phlegms in TCM. We have visible phlegm and invisible phlegm. And that always confused my students. So like, invisible, what the hell? That's a bit woo-woo. What is going on, right? So visible phlegm is something that is going to be thick, sticky, and because it's thick and sticky, it sticks, meaning it's hard to get rid of. That's the problem with phlegm. It's hard to get rid of. It takes a lot of effort and a lot of time and a lot of tools to try to get rid of it. So the visible phlegm would be something like phlegm. Yes, phlegm as in coughing phlegm that's thick and sticky. That is phlegm for sure. Other things are going to be things like cysts. So cysts in the ovary, fibrocystic breast, any cyst, even a ganglion, any cystic acne, that is phlegm. Another one would be obesity. What it means is when people have a lot of excess fat, like a lot. We're not talking about 10 pounds or 3 kilos or 4 kilos, or depending where you are, stones in England. I still don't get the stones, so I won't go there. When you are in the obese range, this excess fat, all that excess fat, that is phlegm. Also plaque in the arteries, so atherosclerosis. And so it is going to be considered phlegm. It's sticky and it blocks the blood flow into the arteries. And then, of course, that can create, if it's completely blocked, right, a heart attack. So that is also phlegm in TCM. And that's visible because you could see it through imagery, right? So it doesn't mean you could see it through the eyes, naked eye, but through imagery. Then there's invisible phlegm. And invisible phlegm is what we're going to talk mostly about today. It's what I call, it's like a yellow sticky film that's basically in front of your brain, in front of your eyes, and affects your way of being able to think in a clear way. So one of the main phlegm symptoms would be feeling foggy, feeling like you have a film in front of your face, right? That's a foggy head. That's really phlegm. Then another one would be anxiety, starting to worry and be anxious and to panic attack, making movies in our heads that are not real, and then getting into an anxiety. That is also invisible phlegm. Depression is also invisible phlegm. So usually with depression, there's always liver qi stagnation because you feel stuck. But depression would be also phlegm. Hallucination, schizophrenia, that is phlegm as well. Auditory or visual hallucination. Paranoia, that is also phlegm, right? So a lot of mental disorders are going to be invisible phlegm. That means that there's nothing we could see technically. But what's interesting is if you've ever seen research on Alzheimer's disorder is phlegm in the brain. When they go after the person has died, and they go into their brain and they analyze the brain and look at what the brain looked like, right, after the person died of years of having Alzheimer's, they realize that there is yellow plaque in certain area of the brain, specifically the memory area and certain area that actually basically impaired the person's life and impaired their way when they were aging and when they were getting older. They get this yellow plaque. When I watched that whole study, I thought this is so TCM because this is the yellow plaque. It is phlegm. So actually with Alzheimer's patients, they actually can see physical yellow plaque in the brain, which I found so cool because it really correlates with what TCM has said for many, many, many years. Phlegm can come from any of the causes of disease in TCM. So let me repeat that. Phlegm can come from any of the causes of disease of TCM. So when we were talking about obesity, for example, it could come from constitution, weak constitution. It could come from overeating, so diet, which is obviously a cause of disease in TCM. When you have phlegm, like you're coughing phlegm, it could come from external pathogen invasion. It could also come from diet. It could come from smoking, like lifestyle, right? No matter what, the phlegm and the invisible phlegm is the same thing. So even anxiety, depression, any mental disorder can come from genetics. So that's a weak essence, right? Constitution is weak. It could come from a lack of nutrients, so diet, missing omega-3, essential fatty acid, all that. It could come from having trauma, an emotional trauma that happened, and then that resulted in anxiety or depression or etc., right? So all causes of disease in TCM can lead to phlegm. So how we get it is also looking at the cause, stepping back and trying to see, can we control the cause? If the cause is constitution or weak essence, we can't do much about it, right? But if the cause is diet, low in supplement, it's an emotional trauma, then we have tools to try to address that and try to either manage or help the person get better, right? That's the idea about phlegm. The tough part is to get rid of phlegm takes a long time because it is sticky. So any kind of phlegm, doesn't matter if it's visible or invisible, we have to have a very clean diet. No sugar, no dairy, no processed food, no alcohol, right? It has to have a really clean diet. Supplement most of the time to make sure we have all the nutrients we need. A really strong, healthy gut. So a healthy gut, I mean a healthy digestive system, so spleen and stomach in TCM perspective. Obviously, that's super important. Also, fresh air, exercise, and probably also counseling. So counseling is also important. When it comes to mental health, we have lots of different tools that we need to use and utilize to help, and a support. It's really important that when people have tough times or have a mental disorder, they need support, specifically family and friends support. What's the best point to treat phlegm when it comes to acupuncture? My favorite point of them all, the best point for phlegm is stomach 40. Stomach 40 is the best point for phlegm. So no matter what, you have to put stomach 40 if there is phlegm, which often is the case with mental health, right? So stomach 40 is one of the best points for anxiety, for depression. And you can see it's a lower connecting point from the stomach to the spleen. So it's really a gut-related point. That's why it's important to have a good diet and to have a really healthy gut in order for the mental, the brain and the gut are very much related, right? So that's how we connect those two. The 13 ghost point. Sun Si Miao was the father of medicine, or often he's called the king of medicine in TCM, and he came up with those 13 ghost points to treat specifically mental health and also neurological disorder like epilepsy, right? That's who started this whole ghost point. In clinical practice today, they're more used to ground the patient, to calm the patient, to allow the patient to go through certain trauma, certain time of their lives, and try to help their body relax into it and center and ground them. When it comes to the 13 ghost points, most of the time we don't do all 13. That would be really not a good thing, right? So the maximum would be 3 ghost points per treatment for a person. That would be the maximum. Usually 1 is enough. Maybe you need 2 or 3, but 1 probably would be your best bet. So we don't want to overdo it and go, okay, let's do all the 13 ghost points. That would not be a good idea. Why is this called ghost point? I think Chinese medicine comes from the perspective that Chinese language is very poetic, right? And the translation is very poetic. And it's hard for us because we're like, okay, the ghost point, right? If I say, oh, I'm doing the ghost point, people are going to go, okay, acupuncture is so woo-woo. What is this? The ghost, blah, blah, blah. So it doesn't matter if you believe in ghost or not. That's not the point. The point is a ghost is the spirit that's living in your house, right? So there's a house, and then in that house, there's ghosts that live there. And that's what people are going to think. Well, those ghost points are exactly that. They are the spirit that lives in the head. Instead of in the house, they live in the mind. So those ghost points are actually ghosts in your mind, meaning that they're not there. They're just renting and sitting in your head like they're sitting in your house. And we need to address the fact that they're there, and we need to try to get rid of them. right? That's the idea. So we need to address the ghosts that are basically sitting in our mind like they sit in a house. And it's affecting the patient because it's residing here and creating chaos and fear and anxiety and other emotions. Long 11 is the ghost point for partnership breakup. So partnership breakup that end up in a nasty way or a bad way where the person is really upset, like mad. A bad divorce where the person is really, really upset. Or maybe it's a bad partnership, maybe a business partnership that went sour. It is really for a breakup of a partnership, being business, or a partnership, maybe a friendship, right? You have a friendship for 20 years and then you have a bad breakup with that friendship and you're really mad the way it went down, the way that person treated you, whatever happened, right? So it's okay to be mad for, a couple of weeks, but some people will hold this for months and months and it will really basically eat them alive, right? So long 11 is a really good point to try to let go of that. That is what we want to use that point for. The next one is large intestine 11. Love large intestine 11, one of the best points to clear heat anywhere in the body. Well, it is also a ghost point, and it is the ghost point that is really useful when people lose control. People have road rage and then they lose control and they start fighting with someone, or they really lose control. The rage make them lose control. So if someone has a lot of rage, that could end up in hurting someone, in being very out of control. That is the best point. It brings the heat down, the anger down, specifically if it's combined with liver 2. Right? Because liver 2 is one of the best ones to bring liver yang down, so which is excess heat in the liver and which creates anger. I've had patients over the years that are parents, and parents sometimes are so stressed because they're running around all day, and then their kids are not listening and they're fighting, and suddenly the parents just gets really mad and start yelling at the kid, and then they feel horrible, right, for what happened, and they feel terrible, and they're like, oh my God, I'm the worst parent ever. We always have to do a TCM diagnosis, no matter what. But adding up these ghost points will bring that loss of control, anger, right out, right? That's what we want to do. So that's a really good point for that. Stomach 6. So stomach 6 is one of my favorite points because it is located on the prominence of the masseter. The masseter is the clenching jaw muscle. So when you clench, you got this masseter that pops out, and that's the top of the masseter. That's where stomach 6 is, and it is on the clenching muscle. So stomach 6 is really good for post-traumatic stress disorder. Most people that have post-traumatic stress disorder, PTSD, are clenching, specifically at night or even during the day, because they're all tense, they're all stressed due to post-traumatic stress disorder. So for anybody that has PTSD, I love stomach 6. I love spleen 1. Now, it's a Jingwell point, so it's prick to bleed, which is not very comfortable. Someone asked me the other day, how do you prick to bleed? What do you do to make it less painful? So first of all, if the person's foot is really cold, it is going to be much more painful because there's no blood circulation in that area. So first, warm up the area, maybe by massaging the toe, by massaging the area, putting the heat lamp over it, but warm it up a bit, right? Otherwise, even when you prick to bleed, you won't get any blood out because there's no blood in the area. Once it's massaged and it's warmer in the circulation, then you can prick to bleed spleen 1. Spleen 1 is used for abnormal uterine bleeding. We use that a lot in clinical practice, but it's also a ghost point, and sometimes we forget that it is a great ghost point. It is used for people that eat their feelings. So it's for emotional eating. Of course, we need to look at the root cause of the problem. Counseling probably will be needed. There's a lot more, but this is a really good point. And I have a lot of patients, specifically female patients, who have a poor body image and they eat their feelings, right? They're like, oh my God, I had a stressful day, and every time I have a stressful day, I go home and I just can't stop eating. Just doesn't make me feel good after. In the moment it helps, but after it doesn't, right? So that's really a good point. And what I wanted to say about this one is if you combine spleen 1 with gallbladder 34, so GB34, GB34 is the best point for self-image and self-esteem. Gallbladder 34 with spleen 1 really helps with poor body image and with emotional eating. Oh, I love, love, love Bladder 62. I know I keep saying I love all the points. Bladder 62 is fantastic for two reasons. First, it's one of the best points when people feel like they're carrying the world on their shoulders. So too many responsibilities. And how many people feel that way? A lot. A lot of our patients have 3 jobs and kids, and they're running around, and they feel like financially everything is difficult, and they have to juggle everything, and they feel like the world is sitting on their shoulder, and they feel overwhelmed, and it's like too much, and it's dragging them down. This is the best point to use. So Bladder 62 is really good for that. On the other hand, it's also a ghost point. This ghost point is generally used for people that have had, this is a tough subject, so I'm telling you right now, this is a tough subject in general, that have had sexual abuse as a child or a teenager. I had a patient for many years. She came at the beginning for literally balancing hormones and a bit of anxiety. So there was anxiety that was there, and we were treating that with the hormones. And then everything got settled and she was much better. And then she came once a month for maintenance, right? And I have to say it was really interesting because one day, because I've known her for years, like 6 years, when she comes in and she goes, how was your day today? And I said, oh, I was teaching this morning and we talked about ghost points today. And she goes, ghost points? That sounds funny. I said, it's just points that are really good to kind of clean up the ghost in your brain, which means basically trying to help with mental health. She goes, oh, that's really cool. And she goes, well, explain, give me a point. So I said, well, there's a point that's on your ankle area, and that point is really good for people that have had sexual abuse as a younger person that resulted in anxiety or depression as an adult, for example. And she stops me and she goes, can you do that point on me today? And I was just floored. I've known her 6 years and I had no idea. I still have goosebumps just thinking about it because I just looked at her and I said, sure, of course. So I did the point. It was so powerful. She burst out in tears right on the table. I was just quite surprised, right? I didn't expect it. And I said, this is good, this is good. I gave her a tissue. And then she basically cried for a little bit longer. And then I said, I'm going to let you be. I'm going to turn the lights down, put some music, and then you can call me anytime. But let it happen. Let the process happen. I came back at the end of the treatment and she said that she cried even more after and more. But she felt like literally a weight was lifted off her shoulders. That was so cool. It really tells you that what we do as acupuncturists and practitioners is so powerful and so rewarding because you can help someone that's had carried emotional trauma for many, many, many years, and you can help them at least get some breathing and some release. So that to me is completely worth what we're doing. That's why I love Bladder 62. You can see why, right? Pericardium 7. So pericardium 7 is the protector of the heart. Pericardium is the protector of the heart. So PC7 is the ghost point for broken heart. A broken heart doesn't mean just a broken heart as in you're in love with someone and they break your heart. Yes, it is for that. If someone breaks your heart, you're in love with them and they break your heart, that is a great point to help you deal with the broken heart. It's also not just about that. It's about any broken heart. When you lose your pet, if you love your dog, your cat, any kind of pet, I love animals. I would have loved to be a vet if I hadn't done what I'm doing. So if you lose your pet, it is a broken heart. Your heart is broken. So PC7 is a really good point for that because you feel brokenhearted. You lost someone you loved so much, your furry baby, right? Anytime you feel like your heart is broken, this is the best point. Now, another pericardium point, but this PC8, so the next point right on the palm, which is a little bit more tender because it's on the palm, is one of the best points for paranoia. So paranoia can be brought on by medication. Paranoia could be part of schizophrenia or any disorder, can be brought on by drugs. A lot of emotional trauma can also have paranoia. We need a lot more. But this is a useful point to add to your treatment, no matter what, if there's paranoia, right? Okay, before we continue, I'm going to ask you if you like my graphics. If you like my graphics, They are all those points, the ghost points, all the acupuncture points are in my book, Acupoint Made Easy. If you don't have it yet, you either have the PDF option, which you can download on any device, and it has lots of links, complimentary videos that is very good to have to complement the PDF. Or you can have the book. It ships all over the world, not everywhere. So if you like the book or the PDF, the link is below in the description. You can go and grab your copy. A lot of people have gotten both, which totally warmed my heart. So let's continue with this point. So this point, Ren 1, first of all, the location of Ren 1 is not easy. We understand that. The location in Ren 1, and you can see it through that picture, it is in a location that's very sensitive to people, and a lot of people might not want you to needle Ren 1 because of where it is located. But if they are comfortable with it, and you have to ask permission because it is located in an area that is sensitive, it is a very good ghost point for both male and female having issue with body image issue that basically they can't reach orgasm because they feel anxious about sex and their sexual being. So people, specifically women after having babies, they feel like they're not really pretty anymore. They feel like they can't reach orgasm because they're anxious during sexual activities and they feel shameful of their body. The body doesn't look as good as it used to be. So they're more in an anxiety state during intercourse or during love making, that they can't reach orgasm because it's more an anxiety than a fun time. So it's the same for men. This is a really good point for men that have erectile dysfunction, specifically when there's pressure. And I have a lot of couples that I see that come for fertility purposes. And they've tried for 3-4 years before they come to see me. And so there's a lot of pressure once you have to have intercourse at the same time every month for ovulation, because we're going to try to make a baby and it's down this time. The husband comes through the door and the wife is like, okay, it's time, let's go. It's a lot of pressure, right? So when that is the case, there is pressure, there is shame behind feeling a body that is not sexual anymore, or feel like we can't reach orgasm because we feel anxiety during the love part of it. This is a very good point. So it is a really good point to use, but again, because of its location, it makes it a little bit more difficult, right? Ren 24. So Ren 24 is your chin dimple kind of point, right? Below the lips. And that's interesting because what do your lips do? They smile, right? So Ren 24 is a ghost point for people that never, ever smile anymore or laugh and are consumed by dark thoughts. So people that are really in a dark space in their mind and never laugh, never even smile. And I've had patients like this. You could say a joke, they could watch a funny movie, nothing. No smile, no laughing, not even like a little smirk or anything, nothing. They are consumed by dark thoughts. I think when we use our observation skills, you could see in that person that they're defeated, that they're in a dark place, and that it's really hard for them to come out of it. So the idea with Ren 24 as a ghost point is to help someone come out of their dark thoughts so they can smile again, so they can be feeling joy again, because those people haven't felt joy in a very, very long time. Ren 1 was a sensitive area. Due 16 is considered a dangerous point because it is right where the foramen is, where the spinal cord goes right through to get to the brain. So the needle technically could go through the foramen into the brain and make the brain bleed. We so don't want to do that. So if you feel uncomfortable needling due 16, you can acupressure it. But if you stay very, 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 very shallow, we should be safe. I will not do this point if you are not qualified. Please do not attempt to do something if you're not qualified. That's super important for me, that the profession of acupuncture keeps being very, very safe and do everything in the right way. So that's super important. So with due 16, even though it's a dangerous point, it is a really good point for people that resist change. So we all know that change is constant. This is something that we know for sure, is that change is constant. You cannot stop change. Some people have a really hard time with change, right? They're having a hard time coping with it. They resist change. It's like, nope, it's going to be this way and that's that, right? But it creates a lot of stress into them because they can't control the change and they are really stressed about it. This is a really good point to use. Let's look at do 23. So do 23 is on top of the head. It's one soon within the hairline on the midline. And do 23 is for dementia. So it is not going to reverse dementia and the person's not going to have dementia. That's not what it's for. It is to try to slow down, to manage it. And so it would have to be done part of a whole TCM diagnosis to support essence, because dementia happens as people age and their essence and their jing, their essence is depleting, right? So you have to start supporting essence early in life. So if dementia is part of the patient's family or anybody that you know has dementia in their family, this is a good point to try to have combining with tonifying essence, so preserving essence like kidney 3, kidney 6, do 4, REN 4. Those points are great to protect the kidneys as we age, and heart 7 because it's a great point for memory as well. So this ghost points is good to use for calming the dementia. If people feel like they don't know what's happening, they lost their memory and they feel all stressed about it and anxious about it because they don't know what's going on, right? And they don't want to lose their memory and they can see it happening and it's very frightening. This is a really good point to calm the mind so we're not as scared when this happens. Let's talk about do 26. So do 26 is a little bit more sensitive. Anybody's ever needled do 26? Let me know. It is quite painful because it's above the upper lip and it is quite a sensitive area. Needling this point is quite sensitive, kind of like do 25, right? Do 25 is at the tip of the nose. Yikes! Do 26 is a very, very good point for intergenerational trauma. In Canada, we have a lot of people, including myself, who were not born here, right? I was born in France, I came here. A lot of my patients are not born here and they come from another country. And sometimes they come from a country where there was war in the last few years and they had intergenerational trauma. Also, some patients, their parents come from a war zone, came here. My patients themselves have been born here, but they are coming from intergenerational trauma background. So this is a really good point. If someone has tendency to laugh for no reason all the time, you know, like they giggle, they're like, ha, you're like, so how do you sleep at night? And then their answer is like, ha, 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 how's your energy? And they start laughing. So you see a pattern of they're giggling and laughing the whole time because they're nervous. Where is that coming from? And a lot of time it's a trauma that is connected to past generation. And that's how the person is stuck in that laughter. So that is a really good point because again, it's above the lips. Remember, laughing is all about the lips, right? We said when 24 was people that never smile or laugh. This is for people that laugh all the time for no reason. And often this is to calm down the trauma that they don't even know is affecting them from past generation. And if you've read research, it is really in our DNA. In our DNA, cells are carrying our past generation trauma. So it's important to deal with them because sometimes we don't know why we feel something, why we feel a certain way. We don't understand why. Well, it could come back from way back when. And that's really hard to treat, right? So this is a really good point for that perspective. We're going to talk about yin tong. Yin tong is not a ghost point. I will repeat, yin tong is not a ghost point. The 13th ghost point is gui feng. Gui feng is an extra point and it is underneath the tongue. So not a great point to needle on most patients, right? Because it's prick to bleed and you go underneath there. It's like, it's kind of like a lot of patients might not be too excited about that point. So often, a lot of people will switch and use yin tong instead. Gui feng and yin tong are the same function. It's to feel like we are connecting with ourselves, we are enlightened, we are connecting with who we are at the core, and we are calm and collected. And wisdomish, that's not a word I know. We feel like we are smart and the wisdom and the sage in us is coming out, right? So basically, it really is for people that just don't connect to their inner core. They're just so outwards that they forget to go inward. This is a really good point to connect inward. And I have a lot of patients that are outwards, which everything is external. They don't connect to their inside. This is a really good point to connect to the insides. So Gui Feng is the 13 ghost points, but often that is going to be switched because obviously it's not an easy point to prick to bleed underneath the tongue. This is my website, AcuPro Academy, and under TCM courses, right under TCM courses, there are courses on mental health. So the mental health and TCM is a free course. If you've done it, I know people really enjoy it. It's completely free, and I talk about phlegm and how to treat irritability and anything that has to do with sadness and fear and all the emotions. So with lots of really great tips. On the other hand, I also have mental disorders and TCM, which address insomnia, anxiety, ADHD, OCD. This course has CE approved by Canada, NCCOM in the States, Australia, the UK. There is so much more on my website. You can go on this and you can see there's courses, there's foundation diagnosis, acupuncture theory, acupuncture protocol, case study. If you haven't been to my website, there's a lot more there. So I really encourage you to check out the blog, the resources, because I have tons of resources. Subscribe to my channel. That would be really much appreciated.